Our great toe. The center ray, we're doing apiaxial of all the toes, oblique and lateral of just the great toe. All right, so that toes require 15 degrees cephalic angle. We can go right to the first black slash mark and know exactly, by the way, first of all, tabletop, and then make sure you measure. Yep, so there we are. All right, so 15 degrees cephalic angle. Done. Center ray, where does it go for if you're doing all of the toes, which we are? It goes to the base of the third metatarsal phalangeal joint. Oh, we must be at it. All right, now here's another thing. All of these joints have to be, you've got to be setting equal. You got to be setting, yep.
Down,
No, you can
like
set.
that.
You can set.
Okay.
But you need to be, all these joints need to be parallel to each other. Yeah, there you go. There we go. Okay. All right, and then collimate down with enough room for your marker. And marker is the great place to put the markers right here. Now we're doing the great toe. So I am going to have the center ray actually kind of towards the base of the great toe, but in the middle of the foot. So we're going to say metatarsal phalangeal joint, third metatarsal phalangeal joint. And this, this gives us room for, and you're going to have to hold on to this because it's hard for your patient, because their foot will always make this slip. All right, so apiaxial view. I'm just going to try to relax your toe. Apiaxial view of all the toes, we're good to go. And now we're going to do oblique and lateral of just the great toe, which usually, if you're going to do a toe, it's the great toe. Center ray is going to be to the metatarsal, the first metatarsal phalangeal joint, and we can see that joint. Do you see it right here? All right, so right at the base of the first metatarsal phalangeal joint.
So is this for the oblique?
No, yes, it is. All right, and now we're going to roll you in that way. There we go. That foot's got to roll.
Okay.
Yep. All right, and we want 45 degrees of this toe. Okay, that looks pretty good. All right, do you see that joint right there? It's always way lower than the other three. And it looks like we're going through the middle of that joint, right? So marker. Good. Now remember that we want the toe of interest to be at a 45-degree oblique. That means the plantar surface needs to be oblique anywhere between 30 to 45. So we want to remember that. And now our lateral. So Amber, we're going to relay you all the way down. Okay. Yep. All right. And then I am just making sure I can feel the joint, but I can't see it. So I can feel it. So this is at the level of that joint, but it's going right in here, pretty much in the middle of this joint. So with that, marker on, and we're good. Now, tape is an X-ray tech's best friend. Are you okay staying like that for a while?
Yeah, I'm sure.
All right, so I'll demonstrate a good way to tape toes. Take 3 strips of tape, and hopefully, now this is the 1-inch transport tape. It's better to have the 2-inch transport tape. But you want to overlay, you want to, first of all, you want to think, how much of a width do I want? Well, I want to, since I'm doing the great toe, I want at least this enough width to tape all of these toes back. So you look at that, and then you have these overlap to give them strength, but at the width that you need. And then, of course, you talk to your patient. Amber, if I tape these other toes back, do you think you can tolerate that? All right, so, oh, no, I'm good. So then I would tape these back to her heel. And then sometimes you need to take another piece of tape, if your patient can tolerate it, and tape the toe of interest forward. And so all you do here, you put the non-sticky side on the toe. But then you gotta flip it, you know. And, you know, so, cause sometimes it works, sometimes you need this and sometimes not, so. Now, during our comp, what you need to do is just tell me. I would tape my patient's toes back. You don't need to do it, but you would just tell me. I would tape my patient's toes back. So let's put you back into an AP. So, AP axial, 15-degree cephalic angle. Center ray to the midpoint, really, of the foot. Now, I know Meryl says the third metatarsophalangeal joint, but really you look at equal light on each side of your patient. And since we're doing a great toe, let's drop the center ray down a little bit, right, to the base of it. And then oblique and lateral of just the great toes. So AP axial of all the toes, oblique and lateral of just the great toe. When we're doing the great toe, is a medial oblique in. Yep. And it, you know, this is a good place to hold your patient right here, right at the ankle. All right, and then we want to make sure we have a 45-degree oblique of this toe. So once we have the 45-degree oblique, we're fine. And you can feel where the center ray should go, is right here. So about right there. That's where we would put it, column 8 down, so enough room for the marker. And now our lateral all the way down. And just tell me, just tell me you would take this person's toes back. And again, you're not gonna be able to see the joint, but you can feel it. So put your finger here and take this, how you can see the center ray coming out like that, put it at the level of where your finger is. But then it needs to come into the middle of the joint, so that puts it about right here. So that it's going right through the middle of this joint. There's some thickness here. So, okay. Amber, we'll let you off the hot spot.